Excuse me, Ma'am De La Cruz. Good morning.
Morning.
I'm Stephanie Ann Bisagi, a student nurse from Polytechnic College at Davao del Sur. I'm going to give the medication.
May I know, ma'am, what's the purpose of the medication?
Because of this medication, decongestants and antihistamine are used to treat the nasal congestions, stuffy nose, sneezing, and runny nose caused by the colds and high fever. So the antihistamine, ma'am, work by preventing the effects of substances called histamine, which is produced by the body. So the effect of this medication, dizziness, drowsiness, and dry mouth and nose. Thank you, ma'am.
Mayong hapon, ma'am. Ako dahil si Dazzle G. Silva, ma'am, from Polytechnic College of Digos po. Unsa gani atong apelyido, ma'am?
Ako dahil si Agnes, ma'am.
Maghatag og tambal nimo, ma'am, ha? Imuha ning imnon unyang alas 6 po.
Unsa din ning tambala, ma'am?
Ang anti-tubular, ma'am, mao kini ang mga tambal na mutambal sa mga impeksyon sa tuberculosis. Ang mga unang epekto sa pag-inom aning tambala is ang pagsakit sa tiyan ug pagkadili komportable, kasukaon ug pagkawala og gana. Pag human nimo inom niining maong tambal, ma'am, malikayan nato ang paglala aning sakita. Ug pag human po nimo og inom aning tambala sa sulod sa isa ka semana o sa isa ka bulan, ang doktor makahimo na sa pagsulti nga ikaw dili na makatakod sa ubang tao. Unya, ma'am, palihog lang kog inom unyang alas 6, mama. Nya mulakaw sa ko, ma'am. Daghang salamat.
A broad-spectrum antibiotic are active against a wider number of bacterial types. It is an antibiotic that acts on the two major bacterial groups. First is the gram-positive, and next is the gram-negative. Gram-positive infection include methicillin-resistant Staphylococcus aureus. Next is the strep infection, and last one is toxic shock. While in the negative infection, it includes salmonella, pneumonia, urinary tract infections, and gonorrhea. And here's the common examples of broad-spectrum antibiotics. It includes azithromycin, amoxicillin, tetracycline, and quinolones. So, if you are not feeling well, I encourage you to buy this product. It helps you to fight against any diseases caused by bacteria. It is available in supermarket and drugstore. And that's all. Thank you for watching.
Hey, are you feeling okay right now, or do you have any signs and symptoms of bronchial asthma, cardiac arrest, nasal congestion, conjunctival congestion, emphysema, bronchitis, or shock? Well, don't worry. This medication is for you. The adrenergic drugs. These are a group of medications that stimulate certain nerves in our body to release the same effects of adrenaline and noradrenaline hormone for a fight or a flight response. This medication constricts blood vessels, which helps to increase the blood pressure, stops bleeding, accelerates the rate and force of contractions with the heart, and it also reduces nasal congestion. Hey, wait, before taking this medication, these are the warning signs.
Side effects:
Headache, tremor, eye irritation, blurred vision, hypertension, tachycardia, palpitation, dry mouth, sedation, anxiety.
contraindications. Patients with
What are methylxanthines? Methylxanthines, or simply just xanthines for short, are a class of medications that are derived from a purine base that is naturally produced in both plants and animals. They work by increasing the amount of cyclic AMP in smooth muscle tissues, which ultimately results in bronchodilation. This is why they can be used for the treatment of reversible obstructive diseases, such as asthma, chronic bronchitis, and emphysema.
Side effects of methylxanthine are
Contraindication: patients with hypersensitivity.
An anticholinergic agent is a substance that blocks the neurotransmitter acetylcholine in the central and the peripheral nervous system. These agents inhibit parasympathetic nerve impulses by selectively blocking the binding of the neurotransmitter acetylcholine to its receptor in nerve cells. The nerve fibers of the parasympathetic system are responsible for the involuntary movement of smooth muscles present in the gastrointestinal tract, urinary tract, lungs, and many other parts of the body.
So the side effects of the anticholinergics are contraindications of anticholinergics.
Good morning, Mrs. Randy. I am Princess Chaya, your student nurse for today from Polytechnic College of Davao del Sur. Today, ma'am, I am going to give you medication corticosteroid prescribed by your doctor.
May I know, ma'am, what's the purpose of the medication?
Ma'am, the classification of this medication is corticosteroids. It used to provide relief in inflamed areas of the body just like in your legs. You may feel some few adverse effects such as high blood pressure, upset stomach, and dizziness.
Thank you, ma'am.
What is mast cell stabilizer? These are anti-inflammatory drugs used to alleviate asthma and several allergic conditions. There are different various forms such as inhalers, oral solutions, and eye drops. What is leukotriene modifier? Just like mast cell stabilizer, leukotriene modifiers may be used for the treatment of certain conditions that are associated with an allergic response. This can be prescribed as a long-term control medication to treat asthma.
Good morning, Ma'am Aragat. My name is Aristine Raya, your nurse for today.
Good morning.
I give you medicine, ma'am, mast cell stabilizer and leukotriene modifier. This is inhaler, drop, and oral meds.
May I know, ma'am, what's the purpose of the medication?
This is to alleviate your asthma and several allergies. Leukotriene should take at least 2 hours before your exercise if possible. The adverse effect are headaches, skin rashes, and fatigue. This might be effect after you taken the medicine, ma'am. Thank you.
Echinacea. Facts about Echinacea. Echinacea is the name of a group of flowering plants in the daisy family. It contains an impressive variety of active compounds such as caffeic acid, alkaloids, phenolic acids, rosmarinic acid, polyacetylens, and many more. In addition, these plants are loaded with plant compounds that function as antioxidants. It is a perennial herb found only in Missouri, Nebraska, and Kansas in the United States. This herb is used for those with low immune status, for hard-to-heal superficial wounds, and as a sun protectant.
It is commonly used to treat the common cold and upper respiratory infections. It has no apparent protective effects but may decrease the duration and symptoms of the infection if started when symptoms are first noted. For the benefits of Echinacea, it has been shown that Echinacea contains active substances that may reduce inflammation, relieve pain, act as antiviral, skin health, and lower blood levels.
Golden Seal. So let's take a look at what we're going to do today on Golden Seal. So we're going to look at the parts used, collection methods, the constituents, the actions, the health benefits, the other combinations, how this herb combines with other herbs, how we prepare, and the dosage, and a cautionary note. So the part used is the rhizome and the root. As you can see here in this image, the rhizome is a part that grows out from a plant to create another offshoot. It's like a root, but it grows generally sideways, sometimes above the ground. So to collect, we unearthed the root and the rhizome from a 3-year-old plant in autumn, and after ripening of the seeds, clean carefully and dry slowly in the air. So the constituents of golden seal are these 3 alkaloids. There are many other constituents, but these are the 3 that I want you to focus on: hydrastine, berberine, and canadine. So the actions for golden seal: it's a tonic herb, meaning that it's good for overall health. It's an astringent, it helps to tighten loose tissue. It's a laxative, so it helps to move the bowels that are constipated. It's a muscular stimulant and a bitter, so good for digestion. So the health benefits of golden seal include: it relieves stomach upset, reduces indigestion, it's antimicrobial, so it kills pathogens or unwanted pathogens. It helps to deal with diarrhea. It's a probiotic. It helps to balance gut flora. It deals with candida, which is an imbalance of gut flora, fungus related. It's an immune booster, which anything that's good for our digestion is good for our immune system, and it's also good for circulation. So it has multiple benefits, a really useful herb to know more about. So golden seal combines very well with chamomile and meadowsweet. Preparation and dosage: as an infusion, pour a cup of boiling water onto about 1/2 to 1 teaspoon of the powdered herb and leave to infuse for 10 or 15 minutes. This should be done 3 times a day. And as a tincture, take 2 to 4 mils of tincture 3 times a day. Cautionary note: avoid during pregnancy, as golden seal stimulates the involuntary muscles of the uterus.
Nutritional and diet therapy via nasogastric tube, feeding and fluid therapy.
Ito yung mga kailangan nyo i-prepare pag mag-NGT feeding kayo. Siyempre kung may tablet medication kayo, durugin nyo para maging powder. Lahat na lang tiniktok ko, diba? Pero ayun yun, natututo kayo. Tapos kung may liquid medication kayo, prepare nyo din. Siyempre huwag nyo kakalimutan yung osterized food or yung milk, parang awa naman. So ayan, empty cup for water flushing. Tapos yung osterized food nyo or yung milk nyo. Tapos yung asepto syringe. And then yung bulb. And then yung powdered medication, and lastly yung liquid medication. Okay na yan, pwede ka na mag-feed, bilisan mo, bye. Through you, I can do anything. I can do all things, 'cause it's you who gives me strength. Nothing is impossible.
So tube feeding is a therapy where a feeding tube supplies nutrients to people who cannot get enough nutrition through eating. Providing all the nutrients you need on a daily basis, tube feeding can improve energy and strength, prevent weight loss, and support your immune system. For many, tube feeding is the only option available to keep them alive.
Fluid therapy.
Fluid therapy is an important component of management for many diseases. Dehydration and hypovolemia can occur secondary to decreased fluid intake or excessive fluid loss from diarrhea, hemorrhage, excessive salivation, third space loss, and polyuria.
Good morning, Mrs. Aragat. I am Kelly Nutok, your student nurse for today, and I'm going to give medication. This is zinc supplement 30 mg. You're going to take this today at 6 a.m. prescribed by your doctor, and protein supplement as well.
May I know, ma'am, what's the purpose of the medication?
For zinc supplement, ma'am, it is needed for your immune function, and the protein supplement is needed for your extra nutrition.
Also, ma'am, you may feel common side effect, which is stomach pain after taking the medication.
Thank you.